Hello, everyone, and thank you for tuning in for another episode of Protecting the Vision, sponsored by the National Optometric Foundation, along with the National Optometric Association. And we're so glad to be able to have this platform, to be able to do this for our community, our listeners. Thank you for listening in. Please share this with your family and friends so that they too can be educated as we share with you today some great information about public health and eye health. We also know that the month of August is Children's Eye Health Month and Prevent Blindness. And we want to encourage parents, if you have not scheduled your child for an eye exam, we want you to go ahead and contact your local optometrist and get them scheduled for an eye exam. Even if your child is not complaining of a problem, realize that they are children and they may not always know what a problem is. They don't know what good vision is from bad vision. So, as a steward for your child, we want you to go ahead and get them scheduled with their local optometrist so that we can see them for their eye exam and make sure that everything is healthy. And if they need glasses, if they want contacts, then we can take care of that later. But we want to make sure that we get them in for a dilated eye exam and make sure that we are going to do our part in preventing blindness. We don't want your child to have issues going on and they go undetected for several years. We want to catch this early on so that we can help prevent the blindness. So today on our webinar, we're going to talk about public health and eye health, and we want you guys to tune in. We got a great speaker coming for you. Dr. Otu is going to give us some information about this, and I'll bring her on in just a moment. But I am Timothy Brown, Dr. Timothy Brown, treasurer for the National Optometric Foundation, and it is my pleasure to be the host for today as we talk about public health and eye health. Just a little bit about the National Optometric Foundation in case it's your first time tuning in to our webinar. The National Optometric Foundation is a nonprofit organization, and we work alongside with the National Optometric Association. We're also there with the National Optometric Student Association, and our goal is to do what we can for the community. We try to educate the community about their eyes and their visual health. We also try to team with the National Optometric Association each year at the National Optometric Convention, which we did in Fort Lauderdale just recently here in July. We did free eye exams for the community there. Some of the people were able to get their glasses the same day. It was a great event. A lot of people came out. We want to thank all of the supporters, the students, and the doctors that came out to help make that event very successful. Thank you, thank you, thank you. We also try to support students who are currently in optometry school, or maybe they're thinking about making optometry their career. We try to come alongside and support them in various ways, financially, with scholarships. We go and visit them, give them support there at the school, try to help them find mentors along the way while they're in optometry school as well. High school students, we try to introduce the profession to them, and we try to serve underserved and underrepresented minority communities throughout the US of A as well there. The National Optometric Foundation loves being able to support the community. We love being able to give back to the community. We like to be involved with churches. We like to be involved also with schools as well. And we like to also emphasize the three silent killers of vision, which is glaucoma, hypertensive retinopathy, and diabetic retinopathy. We want you to continue to be connected to us. There are various ways you can be connected to us through our website, the National Optometric Foundation. We have a website there, nationaloptometricfoundation.com. To continue to allow us to do the things that we're doing, we have great sponsors and donors who give to the foundation to allow us to be able to give financial support to the National Optometric Association. If you would like to donate to allow us to continue to do the great things that we're doing, we have a Cash App, and you can donate to our Cash App, $ protecting the vision as well. Any amount is welcome there. If you can't give $50 today, maybe $10 will do. We'll appreciate you for all that you can do to help us continue to support our students and the community when it comes to their eye health and their needs there. We also want you to go and like our YouTube page. We do have a YouTube page with some of these webinars that we've been doing now. You can go back and look at the previous webinars. We've had various speakers on there sharing great information, whether it's your eye health or talking about your heart health or your mental health. You can go back and review those webinars and share those with your family and friends as well there too. We're also on Facebook, same name, National Optometric Foundation. If you would go and like our Facebook page, we would greatly appreciate that. We are so excited to have you guys following us, staying connected with us, and we want to continue to do these webinars and have a different doctor on different topics, sharing with our community, educating them, and empowering you so that when you go see your local optometrist, you can have a conversation, and the conversation goes both ways and not just one way. All right? Thank you so much for giving me the opportunity to be able to tell you a little bit about who we are. And now let me have the pleasure of introducing our fabulous speaker for tonight, Dr. Otu. Dr. Otu is was born and immigrated to the United States for college. She holds a master's degree in public health and epidemiology and biostatistics with a concentration in global health from the University of Illinois at Chicago School of Public Health, a Doctor of Optometry degree from the Ohio State College of Optometry, and is a residency trained in ocular disease from Virginia Northern Indiana Healthcare System, Fort Wayne. So that's the VA Northern Indiana Healthcare System in Fort Wayne. She believes that public health should be tightly woven into the health professions, such as optometry, and aims to intersect public health and optometry whenever possible. And she's going to share some ways that you can do that as well. So listen in. She began to intersect the incorporation of Cherish Eyesight and Vision in 2020, and has spearheaded the creation of animated stories that depict real-life implications of eye diseases to improve visual health literacy. Today, she is here to explain what public health is, its importance, and how we can take the steps to incorporate public health principles into our practice of optometry. I'm excited to have her on the show. Dr. Otu and I have worked together with the National Optometric Association in Fort Lauderdale. She did a fabulous job helping us with eye exams with the community. And there she is right there with us live today, folks. Welcome to the show, Dr. Otu. I'm so glad to have you on the show.
Thank you. I'm happy to be here too. Thank you for the invitation to come talk about public health and how we can intersect it with optometry so that we can get better health outcomes.
Yes, yes. And we're glad to have you on. It's interesting that you are taking this stand to incorporate, to integrate, to intersect, and make sure that public health is a part of what we're doing in the field of optometry as well. So a lot of our listeners, because they're listening from all around, you know, all the states are tuned in to you. They want to know, what does this doc have to bring to us tonight? And so I want you to take your time in the beginning and kind of tell them, because some people don't know what public health is all about. And I know you have some things that you would like to share and show when it comes to public health. So maybe take a few minutes to go ahead and just dive into telling us, what is public health when we're talking about this?
Sure. So before I do that, I would like the audience to, whenever they hear the words public health, what is the first thing that comes to mind? I'm just curious to know what people think about when they hear public health.
So you guys can post in the comment section there, whether you're on to YouTube or you're on Facebook, you can put some comments down there. Give us some feedback. What do you think it is when you hear public health? You know, what is it incorporating there? You know, is public, open to many people? You know, I'm kind of thinking about that, but we want to hear back from you guys there. So like I said, we want to make this a two-way conversation. So Doc, I'm going to check and see what we may have going on here, and see if we get some feedback coming in from the audience as you need here. And then you can let us know if you want us to proceed with one of your slides here at the moment.
Do we have anything at this point or no?
Not at the moment there. I'm going to still look, and then I'll come back and let you know. Okay, so we got something from Jackie Davis. Jackie Davis is telling us this is a public service announcements there.
Yeah, love that.
We got public service announcements coming through. We got Mr. Dr. Andre Whitehead is saying public health is concerned with the overall health of the population there.
Beautiful. Thank you.
Heart.
Yeah.
From there. So that's good. We're getting some feedback in here. So the
Okay.
people are live today and they are giving us some feedback. So that's good.
Okay.
So
we can proceed.
Go ahead, Doc.
Okay. We can proceed with the next slide. Okay. Next slide. Okay, so this picture right here shows you a number of keywords that public health is concerned about. Okay, when you look at the very first top, we have occupational health and safety. We have that in optometry. When you think about OSHA, right? So OSHA is the administrative department that sets standards that regulates ophthalmic prescriptions and lenses, right? So that is an example of how a public health work is related to optometry. Another thing that public health I think about when I think about public health is food safety. There was a time that Chipotle had issue with food safety, so they were fined. Okay. Another thing that comes to mind is drinking water. If you think about Flint, Michigan, that's another public health concern. If you think about bioterrorism, you have anthrax attack that happened some years ago. You have infectious disease, very recently, COVID and flu. You have vaccines, that is measles and any other vaccine you can think of. We have the Joint Commission. If anyone worked at the VA, you know the Joint Commission is the entity that comes in to make sure that we are doing things right for the safety of the patients. So these are some examples of what public health concerns itself with, okay? Next slide, please. Okay, so in this slide, I have a question for the audience. According to the CDC, what is considered the great achievement in public health history? What do you think it is? Any responses? Okay, we can proceed with the next slide to give the answer. Okay, so the greatest achievements in public health history is in fact vaccinations, okay? Vaccinations have eradicated smallpox, elimination of polio, and has controlled measles, tetanus, flu, and many others. So that is a huge achievement that public health has achieved. Next slide, please. So public health is defined as the science and art of preventing disease. Preventing is it's a key word in public health. You have prolonging of life and promoting health. This is done through organized efforts and informed choices of society, organizations, public and private communities, as well as individuals. So this is what public health is defined as, mostly preventing, prolonging, and promoting health among populations. Next slide, please. So whenever you're being introduced to public health, Dr. John Snow is a very important figure that we have to tell his story, okay? So I will have Nathan please click on link number 1 to hear a little bit about Dr. John Snow. Has anyone in the audience
He was a British physician who was regarded as one of the founding fathers of epidemiology for his work in determining the origins of a cholera outbreak in 1854. He was born on 15th of March 1813 in York to a laborer's family and apprenticed to a surgeon at the age of 14. In 1836, he traveled to London to begin his formal medical education. He graduated from the University of London and was admitted to the Royal College of Physicians in 1850. When Queen Victoria gave birth to Prince Leopold in 1853 and Princess Beatrice in 1857, it was John Snow who administered the obstetric anesthesia. The Broad Street epidemic was a major cholera outbreak that occurred in 1854 in Soho, London, near Broad Street, now known as Broadwick Street. Physicians and scientists maintain two contradictory theories about the cause of cholera in the human body: the miasma theory and the germ theory. Miasma basically means a bad air that causes diseases. Snow did not accept the miasma and argued that theory. He believed that cholera was caused by a microbe-like agent, or germ, that was transmitted through direct contact, polluted water, and filthy clothing. At that time, there was also no appropriate separation of drinking water from polluted water. Raw sewage, for example, was pumped into the Thames not far from where water was taken out for distribution to households and pumps. John started his own research and study by mapping cholera deaths and noting that they were largely people whose closest access to Broad Street water pumps. At the time, the pump not only supplied water to numerous homes in the neighboring streets, but also to several other businesses. He found one group of men working in a brewery on Broad Street who had stayed healthy by not drinking water from the pump and instead drinking their own beer. With more examination, Snow found few water companies such as the South Wark Company were still drawing their water, not far from a number of sewage outlets, which was one of the main water suppliers to Broad Street. John presented his results to town officials, convincing them to remove the handle from the Broad Street water pump. Although they originally opposed his request, the cholera outbreak almost immediately subsided after the handle was removed. A few decades later, the German physician Robert Koch discovered the bacteria Vibrio cholerae as the cause of cholera. Koch confirmed that the bacterium was spread through contaminated water or food, giving credibility to John Snow's theory. John is widely regarded as having founded the subject of epidemiology. Today, you can still see the replica of the water pump installed in a slightly different position to the original, and a pink granite curbstone had marked the location of the original pump. Next to it, a pub named John Snow to commemorate the centenary of his work in the area. Thanks for watching. Please make sure to like and subscribe if you enjoyed.
Okay. Well, thank you for playing that video, and I hope you all enjoyed a little bit of history as to this individual, Dr. John Snow. So as you heard, he is considered the father of epidemiology. He is also considered the father of public health, okay? So now, please, let's move to next slide. So the mission of public health, according to the WHO, is to provide maximum benefit for the largest number of people. So it is population health as opposed to individual health. The mission of public health is also to protect the health of entire populations. That would be locally, nationally, as well as globally. Next slide, please. So now let's compare what public health is and what clinical medicine is. So when you think about clinical medicine, in our case, let's think about optometry. Public health is focused on populations, where optometry, clinical optometry, is focused on individuals. Public health is public service. Clinical medicine is personal on an individual basis. Public health is more concentrated on disease prevention, whereas practicing clinical optometry is more about diagnosing and treating, as well as possibly curing a condition. Public health is focused on health promotion. Clinical medicine is focused on alleviating pain or treating what is present at set time. In public health, training, clinical science is peripheral to the training that people receive, whereas clinical science is very paramount in our training when we go to school as clinicians. Public health focuses on health, evaluating health systems. And I think this part is very important because clinical medicine tends to use the health systems that public health makes or produces. Public health, as we've already talked about, is focused on community populations, whereas clinical medicine is more concentrated on individual. So in my view, these different aspects of healthcare, to me, are fraternal twins. They are both trying to get people good health outcomes. They are just doing it in different ways, okay? Next slide, please. Okay, so at this point, I'm still comparing public health and clinical medicine. For example, you have a problem where an individual gets a car accident. Clinical medicine or optometry, let's say this person had an orbital fracture. We will go ahead and treat that orbital fracture. But public health, in addition to getting physicians to treat the orbital fracture, will proceed to thinking about how and why did the person get an accident. Public health will think, does this person have a vision problem? Does the person have poor driving skills? Was the person influenced by alcohol or drugs? Was the road safe enough for this person to be driving? Was the car safe to be driving? And if the car was not safe, why was the car not safe? Could the person not afford a better car? Could the person not, not have a job and therefore could not afford a better car? What is the social support that would help this patient recover and possibly prevent an accident from happening again? So this is how public health thinks about things. So think about if you have clinical medicine treating injuries, but then you have public health doing all the extra work. Then when these two work together, we have better outcomes, right? Because you don't have repetition of the same mistakes over and over again. Next slide, please. So this is just a picture. And if you look at the little bubble at the top, it says, by the hospital X-ray department, they say, we can only do bits and pieces, skulls, chest, pelvis, and metatarsals. For the bigger picture, you need to see the public health guys. So this is basically telling you that if you want to get a bigger picture of a health problem, a public health individual, public health entity needs to be involved in that problem. So it is best to work together instead of treating public health and clinical medicine as two separate entities. Next slide, please. So here I have examples of public health effort. We have polio. Polio was successfully eradicated, okay, as a result of vaccinations. As we've already talked about, vaccination is a huge milestone or thing that public health has achieved. We have Hurricane Katrina. Again, it was public health that did emergency services, surveillance, and disease treatments, okay? Now we have tobacco laws. And laws banning smoking in public places. This is also a public health initiative. We have obesity. When you think about the Coke bottle you buy or whatever drink you buy from the store, you have the label on there showing you the content of that bottle. Again, that is a public health initiative. And lastly, I want you to think about biological attacks. For example, the anthrax attack that happened in 2001. Again, that was a public health effort to make sure that did not spread, and that could have caused a great, something bad. Okay, next slide, please. So how does public health operate? Public health operates by identifying the underlying problem causing said public health issue. So if you look at the image I have there, you have an iceberg with part of it above water and part of it below water. You have a direct cause and you have an underlying cause. Now, the cause of a public health issue, let's say blindness and vision impairments, is always not obvious. So it is public health that investigates to find the root cause of an issue and tries to address it. Next slide, please. Now, continuing with how public health operates. Public health focuses on prevention and upstream factors. Now, I'm going to use a video here to explain to you what upstream factors are and what downstream factors are. So Nathan, if you can please play video number 2 for me.
River. All of a sudden, a flailing, drowning child comes floating by. Without thinking, you dive in, grab the child, and swim to shore. Before you can recover, another child comes floating by. So you dive in and rescue her as well. Then another child drifts into sight, and another, and another. Eventually, hopefully, some wise person will ask, who keeps chucking these kids in the river? And they'll head upstream to find out.
You can stop the video.
Environmental disaster. Every time a young person winds up in jail.
Next slide.
Every time people have to take medications to make up for the fact that they couldn't afford good food. We're suffering from
the video, Nathan. Okay, can we have the slide back? How public health operates? There we go. So basically in this video, you can see that there was someone downstream and who was picking up all the kids that were accidentally falling into the stream. Now, at some point, you wonder, where are all these kids coming from and why are they falling in the water? And so that is upstream. We want to address issues upstream because downstream, it's very stressful. Now, when you go to next slide, please. So I have this image here showing you some upstream factors, midstream factors, and downstream factors, okay? Downstream factors is what clinical medicine usually does. We treat diseases, infectious diseases, injury, mortality rates happen. Now, midstream, some examples of midstream factors include smoking and nutrition, and I'll explain all this in terms of optometry soon. And then we have upstream, and a very important part of upstream is the policies that we have in society, as well as the different social inequities that we see in societies. Next slide, please. So right here, this is a picture showing you upstream, midstream, and downstream as well. At the same time, you can see that there is a bridge over upstream that helps individuals to cross the stream without falling into the water, okay? So that is addressing upstream problems. Now, if you look downstream where we have tertiary prevention, once again, this is where we keep pulling kids out of the water. This is where people get sick, injuries happen, and clinical medicine intervenes. So tertiary prevention. Tertiary prevention is absolutely good, but how about we prevent the problems from happening before we have to implement tertiary prevention? Hopefully that is clear. If you don't understand, please let me know. But basically, we have primary prevention, secondary prevention, and tertiary prevention. And public health is more concerned with primary prevention as opposed to tertiary prevention. Next slide, please. So going on to explain the downstream factors. Now let's think about in optometry, we have diabetic retinopathy. We know diabetes is a leading cause of blindness in our world. Now, as already stated, downstream factors or downstream interventions is also known as tertiary prevention. I have stated already, pulling the kids out of the water one by one. This is what we do as clinicians. If you think about it, we use a lot of resources, trying to pull these kids or trying to address problems that have already happened. Most of the time, this is where the bulk of our health budget goes. So downstream efforts do not remove the causes of issues. It does not remove the reasons why these kids were falling in the water. We want to strive to change the effect of what is causing the disease by screening for it and by treating them promptly, early, before blindness can occur, where diabetic retinopathy is concerned. So if we want to improve delivery and we want to prevent inequitable access to services. So bottom line, downstream interventions are not bad, but they are not sustainable. Okay, next slide. So now I have midstream interventions. So again, if we think about diabetic retinopathy, we know that diet is a huge part of diabetes. We know that physical activity is also a huge part of diabetes management. So midstream interventions could be proper nutrition as well as green spaces for people to exercise. So again, this is known as secondary prevention. It will focus on improving the working, living conditions and health behaviors. Once again, this is great, but it is not sustainable. Next slide, please. Now we have upstream factors. As we discussed, or I stated previously, a big part to me, upstream interventions include the policies that we have in society. Something I can think of is the cost of insulin at this point. There are so many diabetic people out there, and the cost of insulin is it's a barrier as to why people cannot receive appropriate care. Now, food accessibility, there are things called food deserts. So if we can address food deserts, if we can address green spaces in communities, that's an upstream intervention that would very much help where diabetes management is concerned. So upstream intervention will create positive environment, and that would impact midstream and downstream conditions and interventions. These types of interventions will change micro level national and global policies, okay? They will address the causes of the causes. And this is sustainable. This is what we want to be doing so that our efforts are not in vain. Next slide, please. So this is just a summary of everything. We have primary prevention, secondary prevention, tertiary prevention. Primary prevention is we addressing an issue before it occurs, before disease occurs. Now, secondary prevention is early detection for the potential of, let's say, diabetic retinopathy, and tertiary prevention will be treating the diabetic retinopathy. Any questions for me? Okay, next slide, please. Okay, so public health has a number of core sciences. As I've stated already, public health is focused with prevention effectiveness. We have epidemiology, we have surveillance, which is just like observing the disease. We have informatics, that's a lot of data. And you have laboratory work where you have the scientists in the lab testing for diseases and microbes and such. Next slide, please. So emphasizing how public health works, we talked about surveillance. So going back to our idea of diabetic retinopathy, public health will perform surveillance and identify a problem, in this case, diabetic retinopathy. We will identify risk factors, i.e. what is the cause of said problem. So for example, the cause of diabetic retinopathy would be uncontrolled diabetes. Now we have to figure out what intervention can we implement and how does that work. So an intervention that we can implement is diet changes, increasing physical activity when it comes to the individual level. On a national level or a state level, that has to deal with policies, okay? And then implementation, how do we do this? So one way we can implement this is actually working to eliminate food deserts. If someone lives in a food desert, what they can do is actually get involved in farming. They can, if they have the space for it, they can grow their own vegetables and such to kind of revert the consequences of living in a food desert. Next slide, please. Now, in public health, it is important to talk about what determines the health of a population. So we know very much that biology matters, but how much does biology matter? Very little, okay? We also have health behaviors. Our health behaviors definitely contribute to the health of a population. Now, medical care, that is the clinical care that we're talking about, so that is where optometry fits. And the big chunk of what determines our health as a population is the social characteristics, okay, something we call social determinants of health. So social determinants of health, as I will explain what it is later, leads to health inequities, okay? And then that can lead to health disparities. Next slide, please. So social determinants of health is defined as the non-medical factors that influence health status and outcomes, okay? It is the conditions in an environment that people grow, people are born in, people live, where people age, okay? The social determinants of health affects our delivery of optometry, okay? They will introduce barriers. So if people cannot get access to quality eye care, then you're going to have differential outcomes in the population. So the image on your left-hand side shows you the different social determinants of health: healthcare access and quality, neighborhood and built environment, social and community context, economic stability, as well as education access and quality. As you may already know, employment is a part of this, discrimination is part of this, income, physical and social environments, transportation, housing, all those are deemed social determinants of health. So basically everything outside of a person's biology that will contribute to their health outcomes. Next slide, please. Now, health inequity and health equality, or let's say health equality versus health inequity, okay? Inequality is the differences in opportunities or support to access healthcare, where inequity is unfair and avoidable health differences as a result of social conditions of where people are born, grow, and live. So again, the social conditions could include poverty, racism, discrimination. These factors that contribute to inequity are avoidable as long as we have the right policies in place. It could be addressed. Next slide, please. Now we have health disparities. As defined by the NIH, health disparities are differences in the incidence, the prevalence, the mortality, and the burden of disease and other adverse health conditions that exist among specific populations in the United States. So basically, when you have different groups of people and diseases occur in them very differently, okay? One thing I can think about right now is the fact that the incidence of cancer is higher among people, among Caucasians, but the mortality rate of cancer tends to be higher among African Americans. So why is that the case? There are so many explanations or theories as to why that disparity exists, okay? Now, next slide, please. So over here, I present some disparities that exist in eye care and vision care, okay? We know that, so this disparity actually reflects overall states of health disparities. This is in part because we know that vision and poor eye health is not, does not occur in isolation. So if you have a lot of people who are diabetic or have experienced falls, then those people might get poor eye health outcomes because they might fall and hit the eye, or maybe they fell because they could not see in the first place. So bottom line, disparities in eye care are a reflection of disparities in overall health. We know individuals in Hispanic and African descent are more than twice as likely than Caucasians to go blind from vision disorders of diabetic retinopathy and glaucoma. So that's an example of disparity that exists in eye care. African Americans over the age of 40 have a higher prevalence of uncorrectable vision impairment and blindness than any other age group. So all I'm trying to say is that disparities in eye care also exist just as it exists in other health conditions such as cancer. Okay, next 2 slides, please. Next one. Okay, so right here, I'm trying to use this image here to explain what health equality, as I talked about previously, is. Okay, so health equality sounds like a good thing. It sounds like a great thing. That is giving everybody the same resources regardless of their background and circumstances. If you look at that image, there is a fence over there, and that fence is blocking or making it difficult for people to see across the fence and enjoy the game, i.e. have good health, okay? Now, if you look at the boxes, all the boxes are of equal sizes. So this is where we attempt to give people equal resources, but does equal resources actually give them good health outcomes? That is not necessarily true, because as you can see, the individuals have varying heights. Therefore, giving them equal boxes does not help the shortest person in there. So health equality assumes that all people receive equal treatment. It assumes that they all have the same needs. And while that is something nice to think about, it doesn't really address issues. Next slide, please. So as I already alluded to, health equality is not enough. Health equality is a positive goal. It, however, does not consider that people have different needs, advantages, and circumstances are different. For health equality to be a solution, everybody will need to start from the same place. And we know that that is not the case. Here are some what ifs. If a doctor spends equal time with all their patients, but some patients have more serious health concerns, then we don't achieve much over there. A vaccine is made available to all members of a community, but some people have greater risk of infection. So if you think about when COVID happened, they started rolling out the vaccine in stages where the people who were at risk, who had higher risk of, dying from the infection, were treated first. Okay, so that is practicing equity and not equality. Okay, so next slide. So right here, I am trying to show health equity. So again, if you look at the image there, there is a tree with fruits on there, and attaining the fruit is, i.e., attaining good eye health or good health outcomes. Once again, if you look at the left side, they both have equal boxes, and you can see that the little short guy is not able to reach the fruit. But if you look on the right side where you have equity, and they have varying boxes, i.e. varying help, they can all reach good health outcomes. So essentially, health equity is when everyone has the opportunity to be as healthy as possible. People have opportunities based on their needs. So as we talked about the social determinants of health, when we have these factors addressed, it is possible to attain health equity. Okay, next slide. So health equity, for example, when you have a vaccine, as I was trying to describe earlier, a vaccine is made available to at-risk people before it's made available to everyone. We saw that play out when they were ruling out the COVID vaccine. An organization provides free clinics for people in low-income neighborhoods. A clinic has a translator available for people with different first languages. A doctor alters treatment for everyone who does not have regular access to nutritious food. So basically, when you're practicing in clinic and we figure out the needs of each patient and we take care of them based on their needs, that is practicing health equity. Because when you do it needs-based, then you can help everybody achieve their best health outcome. Next slide. Now, health equality, we said it's a great thing, but it's not good. We need to do better. Health equity is good. Another good thing is social justice. So as I talked previously, we had the fence in place, and the fence represents the barriers in society. How about we take the barriers away? So in this picture, you can see that the wooden fence was taken away, and now you have a mesh fence where you can see through. So we don't even need the boxes. You don't need to give everyone the same resources. You don't need to give anyone help, but they can all enjoy the game, i.e. have good health outcomes, because social justice is prevailing over here. So how do we attain social justice? When the majority and minorities in society work together to remove barriers, okay? Now, I put low vision devices because I have heard comments from low vision patients how they are not able to access low vision devices, or that insurance doesn't cover it. And so one way to practice, and I understand this may not be something that we can address individually, but as a profession, working to, or advocating for low vision devices to be covered by lots of insurances. Okay. Next slide, please. So this slide, I just show all three images in one, and just drawing your attention to equality, equity, and justice. Equality, giving everybody the same resources. Equity, giving people what they need. And then social justice, which means removing the obstacles so that people can attain good health. Any questions? Okay. Now, this slide is, next slide, please, sorry. Partners in public health. So we are very much a partner in public health where clinical care is concerned, okay? Outside of us being clinicians, we have businesses in society, we have the media, we have academia, we have community, and we have government's public health infrastructure. So I want us, aside as being clinicians, I want you to think of yourself as a public health professional, not necessarily having received formal education in public health, but practicing with a public health mindset because you are a partner of the public health system. Next slide, please. So why is it necessary to integrate or intersect public health and optometry? Why is that important? By simply thinking about the magnitude of eye problems we have. If you think about it locally, if you think about it nationally, if you think about it globally, the mere thought that 50% of people living with glaucoma do not know that they have it is something that should emphasize the need of intersecting public health and optometry. The fact that 90% of vision loss is preventable or treatable is another reason why intersecting public health and optometry is warranted. And all the disparities that I previously mentioned are reasons why public health and optometry, in my view, should be working in tandem. Next slide, please. Now, I may be preaching to the choir here because we are all eye doctors and we all know to some extent what the status of vision impairments and blindness is like in our society. Bottom line is that vision impairments and blindness is increasing and will be increasing very much into 2032 if we do not intervene. Okay. So as public health or as a public health professional, we want to nip this in the bud if we could. We want to address especially preventable blindness. If we cannot prevent it, then yes, we will treat it. But if we can prevent it, we should be doing everything possible to be preventing vision impairments and blindness. Next slide, please. So as we know, blindness and vision impairments is something that a lot of people in society fear. You know, when you ask people which of your senses could you afford to lose, it's never vision. More often than not, it's not vision. Now, vision impairments, as we've already stated, that there are health disparities there. There are visual health disparities. When people go blind, we spend a lot of money, okay? There is also disability losses. It's costly. We know that it has some association with mental health, depression. You know, the list goes on and on and on. Basically, these are a few reasons why I think public health and optometry should be working together and at least thinking in ways that you can be more than just a clinician. Yes, not many people want to lose their vision. I would not want to lose mine. Next slide, please. So now I am going to cause us to think a little bit more globally. You know, we have locally, we have nationally, and we have globally. And I bring this up because I want us to, you know, eye problems, if it exists in the United States, many things, if they exist in the United States, exist very much so in other parts of the world. And vision blindness is part. So the United Nations has a universal call to end poverty, to protect the planet, and to ensure peace and prosperity for people. Now, the United Nations has 17 sustainable developmental goals. It is an urgent call for countries. It is a global partnership between, globally, developing and developed countries alike, right? And I'm not going to read off all the goals, but they have recognized that to achieve these goals, we will not be able to achieve these goals if vision and eye health is not addressed. And when they came up with this recognition, or they more so realized this, they had the first ever resolution of vision happen. So next slide, please. On this slide, I would just mention a few of these goals and how vision matters here. So we talk about poverty. 90% of vision is in low and middle income countries, with the poor and extreme poor the furthest left behind. Vision loss costs the global economy for $411 billion every year in loss of productivity alone. So hopefully that is convincing that there is no way we are going to combat poverty without addressing eye health matters. Let's see. Quality education. 91 million children have a vision impairment that do not have access to eye care services they need. Glasses can reduce the odds of failing class by 44%. Children with vision loss are 2 to 5 times less likely to be in formal education in low and middle income countries. So once again, there is no way we are going to achieve the goal of quality education if we do not address vision and eye health. And even if not globally, we cannot do that locally either. We know that kids are not able to learn, or I would not be able to get this far if I did not have adequate vision. One last one, let's look at reducing inequality since we're talking about public health. Women, children, older people, persons with disabilities, indigenous people, local communities, refugees, internally displaced people, and migrants are most likely affected by poor vision. 73% of people with vision loss are over the age of 50. So again, hopefully this emphasizes the fact that we will not be able to achieve sustainable developmental goals until we address vision and eye health. Next slide, please. So following this, I am going to talk about some examples of public health, specifically in optometry. Next slide. So I believe this was, yes, 2023, there was an outbreak of acanthamoeba in Chicago. And Dr. Jocelyn, who is my mentor and very much the person that I give credit to for how far I have come, the story can be later, basically has a public health background, PhD in epidemiology and biostatistics. And she was seeing patients because she works in specialty contact lenses. Now, as she saw patients, she realized that she was seeing too many patients with acanthamoeba coming through. And so, I believe even if you don't have background in public health, hopefully you'll still be able to pick up when cases of acanthamoeba or rare conditions increase, so that you can facilitate some investigation and kind of nip that issue in the bud. Anyway, we know that acanthamoeba risk factors are poor hygiene, swimming in contact lensing, using tap water, or using contaminated contact lens solution. Now, she did a research, she spearheaded that research and was able to help address acanthamoeba outbreak in Chicago 2023. So to me, that was a very perfect example how she brought her public health epidemiology experience into a case of eye health right here in Chicago. Next slide, please. Now we have infancy, and I would assume a lot of you guys have heard about infancy and probably know Dr. Steele. So infancy is a public health program of optometry cares, an AOA foundation that seeks to ensure eye and vision care becomes integral part of infant wellness, okay? So basically, as providers, we can sign up to be an infancy provider. You give eye care to infants between the ages of 6 to 12 months, regardless of the family's income or access to insurance. So this is another big thing that is done, a public health entity that is being done in optometry, and very much appreciate that there is, this intersection and integration going on. Next slide, please. Now, this is also something else that's exciting to talk about, because as you look at the image there, this is a collaboration between Prevent Blindness, which is a very much public health vision entity, and our very own NOA. So the NOA and Prevent Blindness, the National Children's Center of Vision and Eye Health at Prevent Blindness came together to create this campaign. So once again, this is a public health, intervention that's going on, and I am very happy to see that there is some sort of intersection happening. So once again, it's not just me saying that it's important to integrate these two fields, but many others, and hopefully more of you, will buy into the idea that public health and optometry should not be treated as two entities. Next slide, please. Okay, so this is a nonprofit organization called Cherish Vision and Eye Health. And basically, it is my way of trying to intersect public health and optometry the best way I can at this point in my professional career. Now, this was supposed to be a video, but we can't play the video, but I want you to look at the very tiny logo at the bottom right corner if you can. If you can't, that's okay. But basically, it's a logo with the gold part representing a human and the top part, forming an eye. So basically, the golden human represents the public, with its head forming the pupil of the eye, and arms widespread forming the lower eyelid. So basically, it's supposed to symbolize a happy person after preventable blindness and vision impairment or health literacy has been improved. Okay, next slide. So why did I find the need to do such a thing with a nonprofit? Again, hopefully I'm preaching to the choir. We know that visual health literacy is lacking, and that is in part the reason why a lot of our patients are not compliant with the regimen or treatment options that we give them. Now, 70% of people report that vision loss will have a great impact on their eyes. We already talked about how when you ask people about which of their senses will they be comfortable losing, it's never the eyes, right? But regardless of how much value they put to vision, they very rarely attribute any importance to taking care of those eyes. Even if they have insurance, some people don't have any barriers, but they still don't go to the eye doctor. And when you ask them why haven't they gone to the eye doctor, more often than not, the answer is, I have no pain, I have no reason to go. Why should I go? It's a waste of money, on and on and on. Next slide. This is just me trying to emphasize that visual health literacy is lacking, and I don't find the need to do that with this audience, so we can proceed. Now, next slide, please. Okay, so now how do we address the issue of lack of visual health literacy? I thought to use a tactic, you could call it a public health tactic called edutainment. So joining entertainment and education together. So causing people to laugh, have fun, but at the same time, making sure that they have a take-home message from whatever educational piece you give them. So this tactic has been used in different fields to address social issues or different, diseases, and they've had successful implementation. It's been done where breast cancer is concerned, prostate cancer is concerned. Videos were effective at modifying people's health behaviors. And this tactic has not been explored in eye health. So next slide, please. And let's see. So out of this came the project, the Vision Tales. Okay. Now, next slide. So in creating Vision Tales, I had a few of my classmates at the time that it started, as well as students or anybody interested in vision and eye health. We write stories or scripts that highlight real life implications of eye diseases. And once these stories are created, you pass them to artists or animators, and they will animate them in ways to engage the public. Again, entertainment, right? So in ways that people will relate to real life implications, so that people will have fun watching it, but at the same time get a take-home message. And once these videos are created, we disseminate them on social media, different social media platforms, as you may have already seen. And then the goal is to be able to measure impact and hopefully get some sense that this video is helping educating the public where vision and eye health is concerned. Next slide, please. So this is just a slide showing you all the video, not all the videos, some of the videos that have been created so far. We have been able to work with the National Keratoconus Foundation. And then we have some glaucoma videos. We have some sports vision videos, some children's videos. So I'm going to have us play a video that talks about child eye health. And I think it's very appropriate since we are in that month to talk about children eye health. So Nathan, if you can please play the third video, that would be great.
It is estimated that 75 to 80% of learning involves vision. Yet about 1 in 4 children have a vision issue that significantly impacts learning. If a child cannot see clearly, or their eyes do not work well as a team, or they have difficulty focusing while reading, learning can be quite difficult. A comprehensive eye exam with an optometrist is an important step to identify and treat a vision problem so that a child may have the vision they need to succeed.
Oh, there you go. So as you can see, there's a person, and then that's the logo. Hopefully that helps. Okay, next slide, please. So right here, with these videos, the hope is to improve visual health literacy. Next slide. Next. There we go. So the hope is to improve visual health literacy, to bring the issue of preventable blindness and vision impairment to the public's attention. So the video you saw was about a child eye health, but we have diabetes, cataracts, keratoconus, the list goes on and on and on. Now, we want to influence the public's opinion thinking that children don't need eye exams. That's absolutely false. We want to influence people's attitudes. We want to influence people's perceptions about vision and eye health. We want to foster educated decisions when it comes to deciding on, going to see the eye doctor. We want to create a culture of preventive eye health, knowing that prevention is better than cure. Again, when you think back to the very beginning, primary prevention versus tertiary prevention, we want to prevent at the primary stop. We want to implement upstream interventions and not downstream interventions. Next slide, please. So we want to increase utilization of vision health services. We want to create a change in people's visual health seeking behavior. We want to encourage timely diagnosis and treatment of eye diseases. So next slide. So this is the last slide. So basically, how as an optometrist should you intersect public health into your everyday practice as a clinician? So just because you're a clinician and being a clinician fits under the umbrella of public health, by doing your job as a clinician the best way you know how, you would be checking a lot of boxes. However, to go beyond that, I'll give a case of diabetic retinopathy, right? We often tell patients, oh, go see your primary care doctor, oh, eat healthy, oh, exercise, without going the extra mile to find out, where does this person live? Does this person truly have access to good food? Do they live in a food desert? Do they have green space to exercise? So I know we cannot come up with a grocery store, neither can we create a gym or can we create green space. But if we know the resources in our communities to be able to give our patients tangible resources, rather than just tell them, go and eat healthy, go and exercise, go to your primary care doctor, that would be very helpful. And I think that is something that we can actually do and would be very helpful. Now, when you tell your patients, go see your primary care doctor, what if the primary care doctor also tells the patients, go see your eye doctor? Then nobody did their job well because everybody was passing on the work to the next doctor. So actually figuring out the needs of our patients and taking the time to educate them, because education, as we know, is power, that would help people make the best decisions when it comes to their eye health. Another thing that we can do is to find opportunities in the local public health department. I am still trying to navigate that space, but I think there are opportunities there if we can, be a little bit noisy about the importance of vision and eye health in communities and cause the public health department to also see that as an important aspect of someone's overall health. That would be very helpful. And then, kind of put it in the plug for the American Public Health Association vision section. Very welcome to ideas on how to intersect public health and optometry. So that is it for my presentation. Next slide. So thank you very much for the opportunity to talk and explain what public health is. I hope you found a lot of value in it, and I hope you enjoyed it, and I hope you learned something new and have a new perspective of what public health is and have a new appreciation of what public health is. Thank you.
Wow. Dr. Otu, on behalf of the National Optometric Foundation, we are excited that you took the opportunity to share with the communities that's listening and sharing this wisdom about public health and eye health. I love the videos. That's what Dr. Davis said. She loved the videos. The pictures and videos, sometimes they say 1,000 words. It breaks it down, for that child having blurry vision, then getting glasses, that child having blurry vision, underperforming in school, not because this child didn't have the mind, the brains, the wisdom, the education, but he could not see the board. Right. Therefore, his grades were low. But the change happened when we addressed the problem. He got glasses, he could see better, his grades went up, teacher went back there and acknowledged, good job that you did there. I love that. I love the fact that we're talking about combining education with entertainment so it can capture the attention of the public. Sometimes it takes that, educating them, entertaining them, but also giving them wisdom while you're educating them, like a really good movie that has a historical part incorporated in it as well there. You know, we're entertained from the movie, but we're also learning an important history fact while we're watching that movie there as well. Also, I love the fact that you said, why have a plan and don't use it to go see optometrists? The objections, you know, the barriers are down. You have access now to go see a doctor. We saw a young lady today just see an eye doctor for the first time. Well over 35, you know, we were glad that she came, but she never would have come. She told me this, her words, if we didn't see her daughter and she saw how well her daughter was able to see after the exam, and she knew, mom knew that she was having problems at nighttime driving and not seeing well, but she just put it off because she was able to make it. You know, she came and got an eye exam for the first time and was thrilled. Now she's ready to bring her husband and the rest of the family, and she's excited and glad that she did, you know. But I agree with you. We need to do more in addressing the root causes, the root of the problem. And that is where we take the stand in trying to educate our patients, educate them in our findings, educate them in how to do the things that we want them to start doing. Like you said, don't just tell them to eat healthy. Go see your primary care doctor or exercise there. Give them some steps into being successful, because what we are hoping to do is to create sustainable things in their life. There are things that's going to benefit them and change the generations coming after them. Because when we educate them, it's just like they said, you can continue to give a man fish, or you can teach a man how to fish, you know, and then he'll eat forever, you know. So that's what we are hoping that, you know, you guys watching this who may be optometrists, or you may be into the healthcare field there. We want to get to the root of the problem. Dr. Otto is telling us that we need to get to the root of the problem and not just keep throwing medicine at it there, not just keep treating the diseases there. We need to reach back and make sure we're focusing on prevention. And that's what public health is all about there, focusing on the prevention steps. And you laid that out so well, talking about the positive environments that public health will create there, you know, going through the disparities in healthcare there as well, and dealing with equality and equity there, making sure that we are giving everyone, as you said, the opportunity to be as healthy as possible and addressing eye care needs there. So that was just what I gained from it. So I know the listening audience was able to gain some nuggets, and they'll be able to, hopefully the doctors that's listening will be able to go back and start incorporating public health with eye health there and giving the public better care. So thank you so much again for sharing your wisdom in your own way, breaking it down for us, sharing those videos there, giving us a history walk as well there with Mr. Snow there. This was fabulous. And again, I keep telling people that I have the best speakers on these webinars. And again, you have proven me right. So thank you again for that.
Well, thank you very much. It was a pleasure, you know, talking all about this. And yeah, I mean, this is what I hope to do. I hope to, you know, hopefully to talk more, and you have given me opportunity to start it. So thank you.
Absolutely, dear. So people want to follow you. Maybe someone local want to come see you. You can go see her so that she can take care of your eye care needs and educate you at the same time there. I guarantee you, you won't regret it. And it's been a pleasure being able to work with you at our events that we're having there. We're doing the free eye exams for the community there in Fort Lauderdale. It's a great convention there for the National Optometric Association. And looking forward, just putting this out there, we're going to Philly in 2024. So you guys get ready. We'll be knocking on the doors in Philadelphia for the National Optometric Association's 2024 convention. Dr. Barnes is our new president for the NOA. Dr. Whitehead is still the president for the National Optometric Foundation. So we'll be there again, and we look forward to doing a great deed in the city of Philadelphia. So the National Optometric Foundation wants you to continue to be connected to us so that we can continue to share wisdom on these webinars. We have a Facebook page, National Optometric Foundation, where you can go and like our page and follow us on there to learn more about us and keep up with us. We also have a YouTube channel that you can go and subscribe to our YouTube channel, National Optometric Foundation. And we have a website, www.nationaloptometricfoundation.com, that you can go and you can see who our officers are. And you can also subscribe to our page there. And if you would like to donate to our foundation, $ Protecting the Vision is our cash app. We would love for you to donate. We appreciate all who have donated, those who are going to donate, our sponsors who continue to let us do the great things that we're doing. Thank you for the love. Thank you for allowing us as a foundation to mentor young minds, those who are thinking about going to optometry. They're currently in optometry school, as we educate the community along with the National Optometric Association. It has been my pleasure as the treasurer for the National Optometric Foundation, Dr. Timothy Brown, to host this webinar for you as we discuss public health and eye health, and during this month of August, which is also Children's Eye Health Month. So don't delay, do it today. Get your eye exam scheduled with your local optometrist, and we'll see you on our next webinar. Thank you, everyone. Have a great evening.